Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Clarissa Barnes. She's an internal medicine physician, and she wrote the Kevin MD articles, To My Healthcare Colleagues in South Dakota, and COVID-19 is a War on Two Fronts. Clarissa, welcome to the show.
Thank you so much for having me. It's nice to meet you.
So we'll get into your articles in a little bit, but first off, can you share your story and your journey to where you are today?
Oh, sure. So like you mentioned, I'm an internist. Currently, I'm a hospitalist practicing in Sioux Falls. And I've had, in addition to my clinical roles, a variety of sort of different administrative roles, including being the medical director of our wellness program and doing some stuff in clinical documentation improvement that has sort of got me in contact with a lot of different physicians and other healthcare professionals across our system. And so a lot of what I write is really sort of sharing the experiences or the things that are sort of common and tie us together.
So we are speaking in the beginning of November, and South Dakota right now has one of the highest per capita COVID rates in the country. Tell me what you're seeing currently in the hospital.
So it's really sort of an interesting duality because on one hand, you see physicians and all of their healthcare workers, really diving into their work more than ever before because there's just so much.
Mm-hmm.
There's never any sort of onslaught. But it's also, even if you ask them and you say, hey, how are you doing? They'll tell you that they're okay oftentimes, but you can tell that people are just getting sort of more and more emotionally exhausted by sort of the increasingly high volumes, high complexity, COVID plus other diseases, and really no end in sight.
Now, in terms of support during the hospital, like how are you in terms of supplies and just emotional support that you're talking about for the healthcare workers?
Yeah, I mean, I think that supply-wise, I think we're probably in similar situations for sort of everybody. We have, what we need at this point, which has been good. So I think those several months at the beginning of sort of people are trying to figure out, like, how do we react to sort of these new needs in terms of supply chain was a good learning opportunity for us. I think emotionally, a lot of what we do is we lean on each other.
Mm-hmm.
You know what I mean? You have a really rough day and you sort of share with your colleagues because they understand what you're going through. And so you do see a lot more camaraderie as much as you can. I mean, because we're still trying to distance and we're still wearing our masks and we're still doing all those things at work, but, really trying to, lean on each other as much as we can.
How is what you're seeing now compared to what you saw back earlier during the pandemic? Because we're talking about a potential second or third wave. So is there any difference between what you're seeing now versus, say, in March, April, around there?
Yes. So the first wave for us was really, I mean, where I'm at in Sioux Falls, we had one of those meatpacking plant outbreaks. So we were sort of in the news the first time around as well. But at that point, the general public was still pretty afraid of COVID. And so there are a lot of people who were still staying home. So even though we were really, really busy with COVID and that outbreak, the other stuff was sort of not coming in. So at that point, it was really, we got to focus on how do we take care of COVID patients? What do we do? It was very, very stressful because, you're still learning all these new medical things because nobody knew what to do at that point. But at least you had sort of the gift of time because you could focus on COVID and you didn't have to worry about, the other things that were coming in. Now, we're months and months later, healthcare's been delayed. People are coming in sicker than they've ever been. So now COVID is worse than it was the first time around, and we have all the other medical problems on top of that. So the good news is we're more prepared because we understand better what to do. The bad news is it's there's no more of that time. There's no more, well, I'm only doing COVID today. It's really, you're doing everything.
Sure. So let's get into your Kevin MD articles. You wrote a pair of them. COVID-19 is a war on two fronts, and To My Healthcare Colleagues in South Dakota. Now, for the first one, COVID-19 is a war on two fronts. For those who haven't read the article, can you just walk my audience through it and maybe share the story of why you decided to write it?
Yeah, I mean, that article really came out of the fact that, what I was seeing in my own life in the hospital and what my colleagues were seeing in the hospital, was sort of one world where COVID was very present, very, killing lots of people, very, very sick people. And then you would say, okay, well, I'm working, 120%. I'm trying to learn all these new medical things. It's very, very stressful. And then you would come home and be like, okay, well, I'm going to relax. And relax may mean like TV or social media or talking to your friends. And some of those people may be saying, I don't know what the big deal is about COVID anyway. Like, it's not even a thing. It's all a big hoax. And you doctors are just trying to earn extra money, by saying everything's COVID and it's not. And so like this disconnect between like, well, that's not what I'm seeing. That's not reality.
Hmm.
But also knowing that like there's no way for some people to really know because they're not there with you. So how do we take what we see in the hospital and explain it to the general public so that they can understand what we understand, and also take care of ourselves and maybe not dive into, those social media comments that really sort of drive you nuts because you can't get anywhere arguing with some people.
So for those people who may not be taking COVID as seriously, are you talking about Facebook and Twitter, or are you talking about people that you see in a grocery store or even within your social circles?
It's some of both. I think for things like, Facebook and Twitter, I think there's a tendency, and certainly I see it with some of my colleagues, where it's like if somebody says, well, that's not real, like you really want to like argue with them.
Hmm.
And realistically, that's not very helpful, right? Like I don't know that I've seen anybody change anybody's minds by sort of getting into the comments of a Facebook article with
Hmm.
somebody. But if it's somebody that you're close to, if it's a family member or a friend, and you can really sort of have a conversation about like, this is what reality is for me, sometimes you make better headway in those circles.
So when you do share your story and you share what you're seeing in the hospital to those who may not take COVID as seriously, now what are some of their responses?
I mean, for some people, it's actually, it's very surreal because nobody in the history of my life has been so interested in what I do. You know what I mean? Like people aren't like, oh, how was your day at work today? And now people are like, what's the hospital like? What's the patient load like? What's happening? Like people are really, really interested. And so there's a lot of actually appreciation of sort of understanding, because it's very difficult, I think, for people to get a sense of what's happening when all you get are sort of a list of numbers every day. Like this is the new cases, this is the new mortality rate, this is how hospitals are generally busy. It's very different to sort of talk to someone and say, well, I'm telling you what it's like, on the floor. And especially if it's somebody that, knows you well, they tend to trust you a little bit better. There's sort of that weird
Mm.
mistrust of sort of all media sources at this point too. So if you can sort of explain to people in a way and, through a person that they know, it actually is really, really helpful. And they do tend to be pretty appreciative of that.
Now, South Dakota was the site of the Sturgis motorcycle rally a few months back. And when you were seeing that as a healthcare clinician, what was going through your mind?
Oh no. No, I mean, it's interesting because in a lot of ways it's for us knowing what, like you can sort of see what's going to happen. It feels very like Cassandra-like almost sometimes to be like, maybe getting that many people together is not the best idea. I wonder maybe our numbers will go up afterwards, and then to be like, well, look, our numbers are going up. I'm not very surprised, but also knowing that like there's nothing you can do about that. You can't control what people are going to do. Even if they had decided officially to not have it, I think people probably would have still come,
Mhm.
so it's really just mentally preparing yourself for sort of what is likely the outcome of what people are deciding to do.
Now, do you think that there's a connection between the current high per capita rates and the motorcycle rally? Have they made that strong connection yet?
I've seen people try and make those connections. Some of that data is, not as great as I think we would like it to be. You know what I mean?
Hmm.
So I don't know that anybody could say that for sure. I think, part of it is it's really complex, right? Because that rally happens right before people go back to school. So
Hmm.
you have the rally, and then a couple of weeks later, it's back to school, back to college. A lot of businesses at that point, stop doing as much stuff remote. So it's a lot of people mixing. I think at some point, like, I think it'll be really fascinating, a year, 2 years, 5 years from now, as we try and dissect sort of what happened as much as we can. But at this point, I think we don't really know what came from what.
Now, from your standpoint, talking to a lot of COVID skeptics, and I know a lot of physicians, especially on social media, talk to a lot of people who are skeptical of the pandemic. What have you learned over the past few months? Have you learned any tips in terms of communicating with people who may be a little bit skeptical? Or I know you mentioned that some of them couldn't be convinced, but is there anything that you've learned to help
Yeah,
communicate our message a little bit better?
yeah, I mean, I think the message should never really be like, this is my position, this is your position, I'm going to try and change your mind. Because I
Mm-hmm.
think if you're trying to come in with the idea that like, I want this outcome for you, you're
Mm-hmm.
setting yourself up to fail. If you really sort of come into it like, I have knowledge of things that you don't know because I'm in a position, you know what I mean? Like, you just don't know. Like, there's things that if you're not in the hospital, like, you can't possibly have an insight to. I'm going to share that with you. And then in the back of your mind, you're hoping, and maybe that will change your mind about sort of where things are. So I really approach it more with, I'm sharing information about what life is like for me and for people like me working in the hospital. And I hope that more information allows people to sort of make better decisions.
And that segues nicely into the second Kevin MD article that we wanted to talk about, to my healthcare colleagues in South Dakota. Now, can you share the story of that article and what's the message that you want to share with your colleagues through that article?
Yeah, I mean, at this point, we're weeks into this sort of second surge and things are busier than they've ever been. And I see sort of, different people, I mentioned lots of different people in healthcare in that article, worried about different things.
Mm-hmm.
But I also didn't see anyone sort of publicly acknowledging what everyone was worried about.
Mm-hmm.
Does that make sense? Like sometimes there's a benefit in saying things that are unsaid. And I think a lot of people felt like even though they were working really, really hard, there were people sort of at, different levels, actually speaking out into the media who are sort of, still saying, well, things are fine, we're fine. It's not that bad. The numbers are going up, but that's just testing, even though we're sitting here going in the hospital. Well, it can't just be testing because we have more people in beds.
Mm-hmm.
Those people didn't need tests to know that they were sick. They're coming because they're sick. There is an actual problem here. And so I think sometimes, what I feel compelled to do when I write things is really to sort of put a name to things that I see happening around me, because people really do want to be seen. They want to know that somebody's recognizing what's happening to them. And also, I really thought it was a good way to remind people that as hard as you're working, you also need to take care of yourself. You can't put 150% of yourself into patient care every single day and not burn out at the end. You have to sort of, do something for yourself, whatever it happens to be, whatever your relaxation is, because it's a marathon. It's not a sprint, and we still have a long way to go.
We're talking to Clarissa Barnes. She's an internal medicine physician, and she wrote the Kevin MD articles, COVID is a War on Two Fronts, and to my healthcare colleagues in South Dakota. Clarissa, so you mentioned a lot of clinicians are getting burnt out. You mentioned that they need some type of outlet outside of the hospital, perhaps to relax and decompress. Now, what are some other tips that you could give them to help prevent burnout? Because this is something I'm hearing a lot, especially on this podcast.
Yeah, I think, you really do have to create not just physical space between you and the hospital. Like if you're not working, that's great, but you also have to have like some sort of mental space, we're more accessible now than we've ever been. My work email's on my phone. People can call me. I log into sort of our secure messaging app. Like there's multiple ways to reach me when I'm not in the building.
Mm-hmm.
And I'm as guilty as the next person of sort of keeping them on all the time, because you're like, well, they might need to reach me for whatever administrative or whatever. But you really have to find a way to say, okay, well, maybe it's, one day a week, maybe it's half a day a week. Like I'm going to shut everything off. I'm going to be unreachable, and I'm going to do whatever I need to do to sort of take care of myself, spend time with my family, whatever it happens to be. But it's really hard to disconnect physically in your house if you're still sort of emotionally back at work.
Now, from an administrator standpoint, and I have a lot of administrators who listen to this podcast, what can hospitals themselves do to help protect the mental sanity of their clinicians?
I think sometimes people underappreciate like how important it is to be just recognized. I see a lot of administrators saying, well, I can't fix the stress of the COVID situation right now, so I feel powerless to do anything. But physicians and other healthcare workers, like even if you just go, hey, I know things are stressful right now. I see what you're doing. I appreciate you. Like that's halfway there. The second part is, notice what they don't have. You know what I mean? Like if you're noticing like, hey, the hospitalists, they're not getting to go down to the doctor's lounge during lunchtime and have food because they're so busy. Like maybe you need to bring food up to their, room so they can just eat there. And that's something that our hospital did. They recognized like, this is what people need. Like, let's fill in those holes, do the things that they're not asking for. And that, you just need to pay attention. They won't tell you, but you'll notice if you're around.
And my final question, Clarissa, what is your take-home message that you want to leave with the Kevin MD audience?
I think my take-home message really is that, this job is a calling. We don't come to this job by accident. It's part of our core identities. I call myself a physician. I'm not somebody who practices medicine. But at the end of the day, I'm the only wife that my husband has. I'm the only mother to my children. So you also have to take care of yourself and protect that other part of your life, because if you sort of get too far into just that one thing, you're going to burn out. And we can't afford to have, people so burned out that they leave medicine. We need everybody to sort of come along with us. So take care of your patients, but also take care of yourselves.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks again.